can't seem to get enough of the sun. But doctors say catching some rays shouldn't be taken lightly, and they have some information that could help save your life. Our Erica Moffat is live at Penn State Hershey Medical Center this morning with more on how you can protect yourself and your family. Hi, Erica.
Hi, Sherry. Well, you would think it would be something that's pretty easy, putting on sunscreen, but actually knowing which one to choose and how to put it on properly can be quite confusing. That's why we have Dr. Bedreshia here with us this morning. She's telling us a little bit more about the basics, things that, everybody should kind of keep in mind when they're trying to stay safe in the sun. What are some tips on choosing the right sunscreen?
Well, choosing the correct sunscreen can be a very challenging task, and there are several things that you do want to look for. One is looking for the high SPF. At least an SPF of 30 is what I tend to recommend for my patients. Dermatologists will recommend SPF 15 or higher. You also want to look for broad spectrum coverage, including both UVA and UVB protection. And you also want to look for one that is waterproof. And finally, you also have physical sun blockers, which contain titanium dioxide or zinc oxide, which gives you added protection.
Okay. Now, I've seen sunscreens that are, or sunblocks that are even higher than 30. Does it become a point where they're just not doing anything more, that higher SPF?
I recommend finding an SPF that is at least 30 or greater, although you are right, after 30 there is minimal differences.
Okay. What about application? You think you just put a little bit on and you're fine, but not the case. Tell me how you should actually put sunscreen on.
I think a lot of Americans don't apply sunscreens correctly. It's very important to apply generously and evenly on all sun-exposed areas, including the face, the neck, and the hands. If you're going to be outdoors for a long period of time, you definitely want to remember to apply it half an hour before you go out in the sun and every 1 to 2 hours that you will be outdoors. And the other thing you want to do is supplement that with protective clothing as well as broad brim hats and sunglasses to protect your eyes.
Okay. Now, it's something a lot of people don't want to talk about, but, we do spend time in the sun, and there's a lot of dangers that come along with that. What should people be checking for? We have some pictures here. What should people be looking for when considering the fact that they could have some precancerous sunspots?
Well, skin cancer is the most common cancer that we see in the United States, and there are 3 main types that we see. The most common is called a basal cell carcinoma. The second most common is a squamous cell carcinoma. They usually present as non-healing or bleeding spots. The other type that you want to catch early is melanoma, and this is the kind of skin cancer that can be fatal if it's not caught early. So prevention is very important, and seeing your dermatologist early to get this treated early is very important.
Great. Okay, some really good advice. Thank you. You want to make sure you head to your pharmacy. Also check in with your doctor. Make sure that you're staying safe. And this weekend, before you head out in the sun, be sure to put on your sunblock.